always take keen interest and pay close attention to that Saint Mary. Ah. Hello. I've been expecting you. Mary sent ahead a letter explaining your predicament. Well then, don't just hover in the doorway looking timid. I won't bite. Come in, have a seat. Let's talk about how to help you today. Now, although I'm sure you're painfully aware, I'm Beatrice, the barber-surgeon. The barber-surgeon. Barber-surgeon. Mary said that you've already seen Phoebe the healer, that she didn't take note of anything too unusual happening in your mouth. Is that the case? I see. Well, it's always good to get a second opinion, wouldn't you say? And Phoebe, although talented as she is, isn't necessarily a dentist like some. Well then, I do have to disclaim that, of course, I will be needing to get a little bit more up close and personal with your mouth. Is that okay with you? I'll be using my fingers and a few tools here and there just to see what's going on, what it is that's troubling you. Does that sound good? Okay. If at any point you're feeling uncomfortable or you'd like to take a break, let me explain exactly what it is that I'm doing, what tools and instruments I might be using for any particular procedures. Do let me know. I always say a relaxed patient is much easier to work on than a frightened one. Okay. Well, to start, I will be needing to put on some gloves, both for myself and for you. A little bit of protection, some gentle hygiene, just to keep us both safe. These are leather. But they get cleaned between patients, so you don't have to worry at all. I do deal with plenty of different creatures, werewolves, sphinxes, the likes, so sometimes having a thicker glove is handy when you're dealing with sharp things. Okay. I'm going to get you to open wide for me, okay? And I'm just going to take a look at your teeth. Just open wide, that's it. Open wide, that's it. Give me one moment. Okay, I just need to make sure that what I'm seeing is right. If you don't mind. Just open up for me. I don't want to alarm you, but when was the last time you looked in a mirror, perhaps? I see, before you arrived. And when you did look in that mirror, did you happen to have fangs by any chance? No. And were fangs something you were desiring? Also no. Okay, well, you happen to have grown some then. But don't worry, I have just the thing. It won't be difficult at all to just slightly alter the situation going on over there, okay? I'm simply going to have to gently file away or trim away any of that excess tooth that might be protruding downwards. It will be a rather painless procedure, don't you worry. It shouldn't take long at all either. Quite quick. I will just need to take a closer look, tap with a few tools maybe, and get more of a sense of whether or not this is a superficial tooth, maybe some plaque or scale that might have grown up and formed this sort of point, or whether it's something a little bit more strange or unusual. Okay? Well then, first things first, I'm just going to use this tool here, okay? Just to touch and scrape that tooth, okay? Just gently, open wide. That's right, that's right. Open wide. Yes. Well, I can tell you that it's definitely not superficial. There's no brittleness to the tooth, no sort of flaking when I scrape at it. Yes. Okay. So it does appear that I'm going to have to file away that tooth for you, okay? Now, I'll show you exactly which teeth it is that I'm talking about. If you look right here at my tooth chart, it's just these teeth. Your canines, you might say. Just your canines, which have developed into fangs. So, nothing too much to be concerned about. At least it's not the whole set. But, that being said, it won't take long at all to deal with. And should any others grow, you know where to come back. Okay, so before I begin any treatment, it's always important that you feel very relaxed, okay? I don't want to cause you any unnecessary pain or any unnecessary discomfort. So, I will be wanting to apply some Stippleroot powder to the affected gums and teeth and the surrounding areas. Have you ever had Stippleroot powder before? Okay, well, Stippleroot powder, as you can see here, is a numbing powder. It's going to just make sure that all of those areas are numb and you don't feel as much sensation going on when I'm doing my administrations in your mouth. Okay? The one thing to be aware of with the use of Stippleroot Powder is that for some patients, just some, people may experience auditory hallucinations. Nothing to be scared of. Generally just some whispers, 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 or some echoes, 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 echoes. Okay? Nothing too alarming, and the hallucinations should wear off within a few minutes of use anyway. Is that okay with you? Would you like to go ahead with the Stippleroot Powder? Perfect. Okay then. I'm just going to apply it with my finger, just along your gums to begin with, and then each tooth. Okay? So I'm just taking a generous helping. My finger here. I'm just going to tap, 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 tap. That on your teeth, okay? Just tap, 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 tap. Okay. I'm going to grab a bit more. Okay. And just open your mouth a bit wider for me. Just a bit wider, and I'm going to gently rub that in circles. Gently rub that in circles for you. Okay. Now, you will need to let me know once that sensation begins kicking in. Okay. When you start to feel that numbing feeling coming through, or if you start to hear anything unusual, let me know and I'll begin the procedure. Okay. Okay, so you're beginning to feel a numbness now, you think? And are you hearing any of those echoes? You are? Okay. I'll just check that the area is completely numb. Just tap, tap, tap. Okay, you don't feel that? And if I just press with my fingers. Do you feel anything when I press with my fingers? Nothing. Okay. Perfect. That's exactly what we want. Okay. So, I'm going to begin the procedure now. You can just relax back in your chair, sit back. You can close your eyes if you'd like to, or simply listen to whatever voices may be going on up there, okay? Just keep your eyes open for me. I'm just going to be holding your mouth open, okay? just open wide one more time. I'll have a look. Just at the back. Okay. The other side. Yes, I see. So, your teeth are definitely much shorter and flatter, which is exactly what we wanted. But there is a few little shards here or there, just scattered around. So I'm just going to grab some tweezers. We're going to gently pick, pluck, 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 those out of your mouth, okay? Okay. Now, open wide. That's right, open. Last one. Okay. Now, I think that's going to be much better. Just open wide for me. That's right. Open wide, open wide. Yes. Perfect. And there you go. That looks all back to normal. If you want to run your tongue across your teeth, if stipple powder has begun to wear off, you should begin to feel that flatness return. Yes. Well, I'm glad to be of help. Hopefully that means you can return to eating as normal now without much issue or negative sensation. Yes. So, let me see, where's my letter? I believe that was everything, unless there was anything else you had to... Sorry, just open wide for me one more time. Just open wide for me one more time, would you? Well, that's alarming. It would seem that they have grown back. Yes, completely back to normal. Well, as normal as they were, I suppose. Yes, it seems you have fangs again. No need to call for alarm, but I would say those are probably permanent from what it appears has taken place. Would you like me to give it another go? Or? No. Fair enough. Well, I'm sorry I couldn't be of any further help then. I would say that it's likely that these are far beyond the physical if they've appeared like this so quickly. Could be something magical or even supernatural. It's not quite like a werewolf at all. I've never seen this happen before. I'd say your best bet would be to see Cornelia at the apothecarium. I think she'd be able to give you more of an idea of what could be going on there. She's just down the road. I'm sure your map will tell you where, but yes, I'd say that she'd be the most likely person to give you a remedy for this. You should probably check that it's nothing more than what it seems to be. That's definitely what I do. Well, I'm so sorry, my dear. I hope that you have a good evening. A good evening. And should you need any other teeth taken care of or tended to, or would simply like to stop by for a haircut, shave, coloring, styling, you know where to find me. Good night. Good night. Good night. And get some rest.